Hello everyone. So in today's video, we are going to be talking about investigations which are to be done in breast cancer. First of all, we are going to be talking about mammography, which is the most reliable mean of detecting breast cancer before a mass can be palpated. So most slowly growing cancers can be identified by mammography at least 2 years before they reach this detectable size that could be um, detected by palpitation. So mammography, which is also called as mastography, is the process of using low energy X-rays, usually around 30 kVp, that is peak kilovoltage. This is the maximum voltage which is used in this technique to examine the human breast for diagnosis and screening. Most common findings associated with sarcoma of the breast are clustered pleomorphic microcalcifications. Now these are and they have variation in size and shape, and they are microcalcifications, which means they have calcium deposit, which could be calcium oxalate or any other type. Those things are being deposited and form clusters in breast, so those things can be detected by this technique. Other imagings include MRI and ultrasound. These things can be used in women who are at high risk for breast cancer, but not for general population. If distant spread is suspected, the CT of the thorax or abdomen can also be done, and isotope bone scan are required. So if there is some um, suspicion to be done for bone, then we can perform isotope bone scan. So uh, now if we talk about biopsy, the diagnosis of breast cancer depends ultimately on examination of tissue or cell removed by biopsy. The simplest biopsy method is needle biopsy. So either by aspiration of tumor cells, that is FNA. FNA stands for fine needle aspiration cytology, or by obtaining a small core of tissue with a hollow needle, that is core biopsy. So large needle, core needle biopsy removes a core of tissue with a large cutting needle and is a diagnostic procedure of choice for both palpable and needle and image detected abnormalities. So both abnormalities which can be detected by image techniques or by palpating, those can be confirmed by this. So FNA cytology is a technique whereby cells are aspirated with a small needle and examined cytologically. And treatment should never be undertaken without histological or cytological diagnosis of the cancer cells. So now if we talk about biomarkers and gene expression profiling, so determining the ER, PR, and HER2 status of the tumor at the time of diagnosis of early breast cancer, and, if possible, at the time of recurrence in is critical both to gauge a patient prognosis and to determine the best treatment regime. So if cancer has estrogen receptor positive, uh, if cancer is having estrogen receptors, then it will be called as estrogen receptor positive. But if a cancer is having receptors for progesterone, then it will be called as progesterone receptor positive, PR positive. Another key element in determining treatment and prognosis is the amount of HER2, that is human epidermal growth factor receptor gene. And now, as we know, um, every receptor which is present in your body or anything that is present in your body has some gene which is encoding that thing. So this receptor is being encoded by this gene. So if this gene is present in cancer, it will be called as HER2 gene positive receptor, positive cancer.